Today, we're diving into an innovation that might just change how we diagnose and understand cancer: multiscale magnetic resonance, elastography, or mMRE. It's a fancy name for something pretty fascinating and surprisingly intuitive. It's about using advanced imaging to explore the stiffness, fluidity, and even the stress within tumor tissues. Think of it like being able to not just see a tumor, but to feel its texture in remarkable detail without ever touching it. This kind of capability could redefine what's possible in personalized medicine. At the center of this groundbreaking work is an interdisciplinary research team at Charité Berlin. They're pioneers in combining cutting-edge imaging science with insights into biophysics and cancer biology. Leading this center are Professor Dr. Ingolf Sack, an expert in medical imaging, and Dr. Jing Guo, who brings incredible expertise in imaging technology. Together with researchers from radiology, surgery, and pathology, as well as scientists from the universities of Dresden and Leipzig, they've pushed MRE to new heights, taking it from a niche tool into something that could soon be integrated into routine cancer diagnostics. Now, what makes mMRE such a big deal? Let's take a step back to something we all know: manual palpation. That simple diagnostic tool where a doctor presses on your skin to feel for lumps. Elastography takes that idea and supercharges it with advanced imaging. It identifies mechanical properties of a tumor, like how stiff it is or how fluid-like its structure might be. And here's the kicker: these mechanical traits aren't just quirks. They're tied directly to how tumors behave, like whether they'll stay dormant or turn aggressive. This team at Charité isn't merely building tools, they're building bridges. They've unified expertise from biology, physics, radiology, and even mathematics to unravel these mechanical secrets. It's science at its best: collaborative, curious, and completely forward-thinking. And it all marks a key point in bioimaging's evolution, much like how the advent of the stethoscope enabled doctors to listen to the heart and lungs for the first time. It's that kind of breakthrough. And here's where mMRE becomes more than just science. It's about potential. Potential to predict, not just detect. Potential to identify tumor behavior far earlier. Potentially saving lives by tailoring treatments in ways we've never seen before. The researchers have built not just methods, but a new language for interpreting tumor biology. And they're just getting started. When we think about what makes a cancer dangerous, what makes it aggressive or likely to spread, it's not just about the size of the tumor or what's in it genetically. It's also about where it lives, the tumor's microenvironment. Now, this is the amazing part. Scientists at Charité have discovered unique mechanical properties in this environment that can literally change how a tumor behaves. Things like stiffness, fluidity, and something called solid stress all play a part here, and they're not random. These properties can influence whether a tumor stays put or starts to invade surrounding tissues. This is where it gets even more fascinating. The research team has dived deep into cellular mechanics, how cells physically interact with each other and their surroundings. By using advanced micromechanical testing and molecular profiling, they've built a kind of roadmap that shows how a tumor transitions from being dormant to aggressive. Think of it as understanding the difference between a car parked in neutral and one speeding down the highway. It's not just the car itself, but the road conditions enabling that acceleration. Now, here's a real-world example. Imagine doctors diagnosing a patient whose tumor is currently non-invasive. Thanks to these mechanical insights, physicians might predict if and when the tumor could become aggressive, helping them decide between active surveillance or earlier treatment. It's like having a crystal ball for the future of disease progression, and that's something patients have been asking for. Will my condition worsen, or is it stable? This question of how and when to act is at the heart of what this team is tackling with their research. One of the most cutting-edge approaches they're implementing is combining in vivo and ex vivo techniques. In vivo means studying the tumor in its natural habitat within the body, while ex vivo involves analyzing tissues outside of it. By using both methods, they get a comprehensive picture of how these mechanical features evolve, answering critical questions about how tumors respond to treatment or resist it over time. The implications here are massive. This isn't just theoretical. It can deeply impact how clinical decisions are made, From choosing surgical interventions to designing targeted therapies, identifying these mechanical drivers of tumor behavior is starting to feel less like a puzzle and more like building a guidebook to tackling cancer itself, one structural clue at a time. So, we've explored how multiscale magnetic resonance, elastography reveals the mechanical properties of tumors, like stiffness and fluidity, and how these traits can give us a deeper understanding of their behavior. Let's take it a step further. What if this technology could not only help us understand cancer, but actually change how we approach diagnosing and treating it? That's exactly the strategic goal of this research unit. The idea here is pretty profound, using non-invasive techniques like mMRE to develop something called mechanical imaging markers. Think of these markers as a brand new diagnostic toolkit, finely tuned to detect the earliest signs of cancer's malignancy. Imagine not just seeing a tumor, but understanding right from the start if it's likely to grow aggressively or stay non-threatening. This precision could save countless lives and dramatically reduce overtreatment or undertreatment of patients. And that's not all. These advancements in mMRE are opening doors for better monitoring during cancer treatment. Picture this: a patient undergoing therapy has their tumor imaged with mMRE over time. By tracking mechanical changes, doctors could pinpoint whether the treatment is working or if adjustments are needed. It's like having a real-time playbook, tailored specifically to the patient's unique tumor mechanics. That's the game-changing potential we're talking about here. Let me bring this closer to reality with a clinical case. Suppose a patient has a suspicious solid nodule in the liver or pancreas. Traditional imaging might only show the size and location of the lesion. But mMRE goes further. It measures the mechanical compliance, such as stiffness and fluidity, of the tumor and its surroundings, indicating its aggressiveness and malignant potential. From this data, doctors create a treatment plan that either leaves the lump untouched or, if it's aggressive, fits the tumor's behavior perfectly. The result? A targeted therapy designed not just to treat, but to outsmart the cancer. How's that for precision medicine? And the beauty of all this lies in its potential ripple effects. As mMRE evolves, so does its ability to inform not just diagnoses but therapy innovations, like treatments tailored to specific mechanical signatures of tumors. It's a vision of cancer care that feels both high-tech and profoundly personal. So there you have it. Multiscale MRE isn't just carving out a new frontier in cancer diagnostics. It's giving patients and doctors better tools, clearer answers, and more hope. And on that note, we'll wrap things up for today. Until next time, stay curious and stay inspired.